Hi, my name is Anya Pandita, and today I'm going to go in depth discussing major depressive disorder. First, some background on this topic. So, depressive disorders and the bipolar disorder are related disorders, and they are classified by emotions that violate the criteria of normal moods. So, furthermore, those with these disorders have emotions in which the quality, intensity, and duration of the person's emotional state does not seem to reflect what's going on in his or her life. So, in a normal person per se, their emotions often reflect the events that are happening in the current moment or in the surrounding moments. But these people don't experience this. So, for example, a person may feel some sort of pervasive sadness despite having the best of circumstances surrounding them. Or a person may feel extremely energetic or overconfident and not have any apparent justification for these feelings or for these emotions. These disorders are often labeled as a mood or affective disorder because the disturbed emotions and moods are the general symptoms of them. So DSM-5 classifies depressive and bipolar disorders separately, and in this video we will only be discussing major depressive disorder. So major depressive disorder is often hard to understand for those who haven't experienced it, and a lot of people that have experienced it and described it have described it as being stuck on an island by yourself, and you can see people across the way on another shore, but you can't fathom any way of getting yourself there. And so there are 4 classifications of symptoms of disorder, including emotional, behavioral, cognitive, and physical symptoms. Emotional symptoms include those such as feelings of sadness, hopelessness, or emptiness, or feelings of disconnection from others, which are kind of the typical things that you think of when you think of major depressive disorder. Behavioral symptoms include less smiling, a dejected facial expression, spontaneous crying, loss of interest in usual activities, or withdrawal from any social activities. Examples of cognitive symptoms include difficulty thinking, concentrating, remembering, a general sense of pessimism, or an influx in suicidal thoughts. Examples of physical symptoms, lastly, include a decreased appetite, increase in feeling bodily aches and pains, a seemingly loss of energy, and an increase in anxiety. So one major symptom that is really important to discuss too is the presence of abnormal sleep patterns, and this presence of abnormal sleep patterns, which are really common in people where they're not sleeping at normal times or sleeping enough. And then also the pervasive negativity and pessimism are often manifested in suicidal thoughts, which are another thing that's really important to discuss because approximately 10% of those suffering from major depressive disorder often end up attempting suicide. And then so to be diagnosed with major depressive disorder, an individual must be showing these symptoms or symptoms that I talked about, related ones, for 2 or more weeks. In some cases, there's no explanation for there is no explanation for the persistence in the depressive stages, but in others, the stage could be triggered by a negative life event or a stressful situation. One specific situation, the death of a loved one, requires specific attention. So the most recent Diagnostic and Statistical Manual changes the qualifications for depression following the death of a loved one. More specifically, the previous editions of this manual outline that symptoms that may accompany the loss of a loved one don't qualify as symptoms of a major depression unless they have lasted for 2 months as compared to the normal qualifications, which is lasting for 2 weeks. DSM-5 removes this qualification for the reason that the death of a loved one, like any other traumatic or stressful, sad experience, may trigger a depressive episode. The textbook quotes that while it's normal to feel a sense of loss and deep sadness when a close friend or family member has passed away, feelings of worthlessness or emptiness or self-loathing are not normal, and this may be symptoms of a major depressive disorder as compared to just grieving. This disorder can happen whenever, but there are some people who experience worsened symptoms at certain times of the year. For example, with seasonal affective disorder, episodes can be predictable based on the changing seasons, especially in autumn and winter months where it's more gloomy outside. Seasonal affective disorder is more common among women and among people who live in northern latitudes because the winter period is longer. Some may experience a form of chronic depression called persistent depressive disorder, which may be the result of a stressful event. Though the person affected by this may function normally, they often have a chronic sadness that could persist for years on end. And so moving on now, major depressive disorder is among the most prevalent psychological disorders. Furthermore, it's also one of the most devastating illnesses worldwide. About 7% of Americans are estimated to be affected by major depressive disorder, and many researchers have estimated that about 15% of Americans will be affected by major depressive disorder at some point in time in their lives. Women are more likely to be affected or to be diagnosed with major depressive disorder than men. And many people with this disorder try to cope with it rather than just finding treatment or going and getting professional help. Left untreated, Okay, symptoms can easily last 6 months or longer. Continued mistreatment can cause the disorder to become more and more severe, and more than half the people who have been through one episode of major depressive disorder can expect a relapse, usually within 2 years, and then after relapse, symptoms usually tend to worsen. And that's all for major depressive disorder. Thank you for watching this video.